What is mechanical ventilation? Mechanical ventilation is considered one of the most important topics of critical care nursing. Mechanical ventilation is defined as it is a life support technique where with the help of machine we provide breathing to a patient. Why we provide breathing with the help of machine? Because patient is unable to breathe himself. So this reason we use a machine called ventilator through a special technique an expert know. The purpose of ventilation, there are three main purposes. Number one is maintain oxygen supply. Because normally we inhale air. Through this inhalation we take oxygen and then we exhale. So we remove carbon dioxide. So ventilator do this job. Ventilator give oxygen and then it also help us to remove extra carbon dioxide, and also the third and the most important, with the help of machine it reduce the workload of breathing, because the workload of breathing is now doing by a machine, not by a patient. So it reduces the basic idea how a ventilator actually works. In normal case, a normal patient inhale air through mouth and then our lungs expand, and then we exhale air in the form of carbon dioxide and lungs comes to its original position. Now, during a ventilator patient is unable to inspire oxygen through forcefully. So with the help of machine, air goes to our lungs is expand. And then for a short second, the ventilator stop the air. Then lung comes to its original position, and then during this way carbon dioxide removed. So this is all about the concept of a ventilator. In next video, we will talk about the indication of mechanical ventilation when we actually need mechanical ventilation. So if you like this video, you can follow, and if you have any type of question or confusion, so you can comment on it.